If you're watching this, you or someone you love may have a foot wound, a diabetic ulcer, or an infection that just doesn't seem to be getting better. I need you to hear this clearly. That wound could already be in your bone. And if it is, and it goes untreated, we are not just talking about losing a toe or a foot. We are talking about sepsis. We are talking about your life. My name is Dr. Kevin Lamb, and I'm a podiatrist here in Southwest Florida. Every week in my practice, I see patients who came to me too late, patients who waited, patients who hoped a wound would heal on its own, patients who had no idea how fast a simple foot infection can turn into something deadly. Here's what happens. It starts small, a cut, a blister, a puncture wound from a nail or a shell on the beach, maybe a corn or callus that broke down. Bacteria enter the skin. At first, it looks like redness, maybe some warmth, maybe a little swelling, and people think it's probably nothing. But if that infection isn't treated aggressively and immediately, it goes deeper, into the soft tissue, into the tendon, and then into the bone. When infection reaches the bone, we call it osteomyelitis, and this is where things become truly dangerous. Osteomyelitis is not something antibiotics alone can fix. I want you to understand that you cannot take a pill and make a bone infection go away. The bacteria live inside the bone tissue itself, and antibiotics, even intravenous antibiotics, often cannot penetrate deeply enough to eliminate the infection without surgical intervention. That means removing infected bone. And the longer you wait, the more bone we lose. In the worst cases, we lose the entire limb. Now, who is most at risk here in Southwest Florida? If you have diabetes, you are at the top of that list. Diabetic patients spend more time in the hospital for foot infections than for any other complication of diabetes, and the reason is devastating in its simplicity. Diabetes damages your nerves, so you don't feel the wound developing. It damages your circulation, so your immune system can't fight back. And high blood sugar actively feeds the bacteria. A small ulcer on the bottom of a diabetic foot can reach the bone in a matter of days, but you don't have to have diabetes to be at risk. If you have chronic swelling in your legs, if you've had a joint replacement, a heart valve replacement, or a pacemaker, or if you're on medications that suppress your immune system, any foot infection must be taken seriously immediately. Here is what I need every person watching this to understand about what happens when infection is left untreated. When bacteria from a bone infection or even a serious skin infection enter your bloodstream, that is called sepsis. Sepsis is not the flu. Sepsis is not something you sleep off. Sepsis is organ failure. It is your body turning against itself, and it kills fast. If you or a loved one has a foot infection and you notice high fever, chills, a rapid heartbeat, confusion, or red streaking moving up the leg from a wound, do not call my office. Go to the emergency room immediately. That is a life-threatening emergency, and every minute matters. In my practice, we take foot infections seriously from the very first visit. We don't guess. We use advanced imaging, including MRI, bone scans, and X-rays, combined with years of clinical experience to determine whether infection has reached the bone. And when it has, we act. Surgical debridement, removal of infected tissue, targeted antibiotic therapy, and wound care that actually heals. Our goal every single time is to save your foot, save your limb, and save your life. If you are in Fort Myers, Cape Coral, Naples, Bonita Springs, Sarasota, Marco Island, or anywhere in Southwest Florida, and you have a wound that isn't healing, a foot infection that isn't improving, or a diabetic foot ulcer that has been open for more than a few weeks, please reach out to us today. You can learn more about our practice and request an appointment at naplespodiatrist.com. That's naplespodiatrist.com. Do not wait for your next scheduled appointment. Do not wait until it gets worse, because here is the truth. Early treatment saves feet, and aggressive treatment saves lives. We are here for you, and we are available 24 hours a day to schedule your appointment. Call us now, 239-430-3668. That's 239-430-3668. Don't wait. Call right now.